Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing a COVID-19 update for July 21st, 2022. Usually do these on Friday, but I'm doing it today on Thursday. Falmouth Health Department's phone number is 508-495-7485. Our email is health@falmouthma.gov. We're at 5,111 PCR positive COVID tests since the beginning of the outbreak. There's been 29 during the 6-day period, because we're on Thursday. It's actually a 5.5-day period, and 95 for the couple of weeks between the last update on the 8th, the 7/7 to 7/19, has been 95 PCR. These are just PCR. That's not total case count, because we do not know what home test results are. 30 probable from 7/7 to 7/19. These would be rapid tests administered by a proctor that goes through the system, because I'm only going to have access to what goes through the system, which is going to be PCR or rapid antigen tests, not home tests. So there's some multiplier that could be 3 to 5 times more actual cases. Our 14-day incidence rate between the 26th of June and the 9th is 20.2, and our positivity is 8.28, which was previously 7.15. So kind of flat. A little up on positivity, which is a percentage of positive PCR tests and the number of tests given. And we're around 24, so we're a little down on the incidence rate, but I would say we're pretty flat. If you look at the curve, the far right would be, those dots would be the last couple of weeks. The increase of the week before was more like 8 days, just when I happened to grab the test, run the report with the case numbers. I usually try to always do this on Thursday at 4, but it didn't work out that way. So it was more like Friday morning, and so the little dip is actually average amount a little bit more. It's really a little bit flatter than that, more towards around the 45 to 55 cases per week, and we've been in that row 5 weeks. Sort of what our summer numbers are. So these are PCR only, and we're averaging about 45 to 55. And again, there is going to be some multiplier higher when you add the home kits. So basically, there's a pretty good amount of COVID around, and that's true everywhere in this country. So we're pretty high, higher than we'd probably like to be, especially for the summer. If you look at summer of 20 and 21, but then we don't have any mitigation, and we have variants that spread better, but are generally milder when you look at especially without a vaccine. But when you look at more like when you had with Delta and so forth, so not mild, but milder. So yeah, we've just definitely COVID around, no doubt about it. We're on an upward trajectory. Again, the flatter and the closer the blue dots are, the better we're doing for that particular time frame. We're on an upward trajectory. We have consistently 50 or so cases. Again, this is all based on PCR. It doesn't look like January's, where the dots were really spread out and going up rapidly. Those are bad times with the original Omicron of January. So we're sort of in a pattern of around, like I said, 45 to 55 a week. We are in the medium category for CDC. What that does is it look at case counts. It also looks at hospitalizations and the burden on the hospital. Our numbers for cases per 100,000 is lower. And so we can either be low, medium, or high. We're in the upper non-shaded portion that says fewer than 200. But you need to have an admissions per 100,000 under 10, and we were 10.3. And we are definitely under the 10% to 15% for percent of inpatient beds occupied by patients. So 2.9 of inpatient staffed beds are occupied by COVID patients. Admissions are, they do that one differently. They don't go by percentage. They use that by like an incidence rate. So it's admissions per 100,000, and it's 10 per 100,000 people getting admitted, or people being admitted to the hospital with COVID. And so we're in the medium category mainly because of that 10.3 being higher than 10. Not in the high medium, we're in the low medium, I guess is the best way to say it. So we're hitting 2 out of 3, but we did not hit it on that admissions. In terms of hospitalizations, you can see this is from the CDC as well, tracking hospitalizations. First spike, see the 2 spikes in January. The first one was Delta, the second one was Omicron. The third one was a slight one in sort of May. Then we dipped a little bit, and we're sort of a little bit on the upward side over the last week. There has been more people in the hospital. Not nearly at the level of those other 2 peaks, but it still is happening, especially those that are unvaccinated or people with a weak immune system, even if they have been vaccinated, very elderly, people with COPD or diabetes and stuff like that. So it's not gone away. It's not gone away. It's more about living with it, I guess, at this point in time. And so, there's an ebb and flow to this, and it's flowing just a little bit on the flow side. This is now going to be done weekly. This is the state's chart. This is done on a weekly basis now, not done daily. They updated it on Thursdays. So there was 7,000 cases during the time frame, the week time frame. Positivity was around 8%. It's been between 8 and 10. Falmouth, I'll go into the county in a second. 31 deaths over the week. So that's where we are with the cases. The trends are deaths never, we have vaccines, and these are variants that are less likely to cause death, and you can see that sort of flatlined out. Not flatline is not a good word, sorry, but sort of there's no growth curve to this. It's sort of meandering there at a relatively low rate, which is great. Similar to the cases are sort of flattened at that little spike in May, then it seems to be flat now, flattish now. So we're sort of in this pattern. I think everybody, if you looked at other towns, and let's say they were a town of 5,000 and they had, they were averaging 12, they've probably been averaging 12 similarly for the last 4 or 5 weeks like us. So it's not like we're seeing spikes per se, we're just seeing sort of a hum, and sort of continuation of what we've been seeing for most of the spring of a fair amount of cases, not really burdening too much the hospitals. So this is MWRA, shows you the viral particles of COVID, and the orange onto the left would be the south side of the MWRA, which is this greater Boston area sewer system. The north system, you see that it's sort of relatively flat, similar to what the case counts were in Falmouth. So you see in that sort of May, you get a little up. We also saw an up. You see sort of this meandering sort of up, down, week to week, but it's relatively flat line over time. That's kind of where we're at now. So COVID's around, and this is sort of like the hum we have. Our incidence rate, which is the number of cases, this is all adjusted to the same population, so it makes everybody 100,000 per population, so that these numbers are equal, and and so the smaller towns wouldn't automatically have a lower number. Falmouth is sort of in the middle there. Barnstable was 23, Dennis was 28. We were 20. Towns that were lower would be like Eastham. Sandwich was about the same as us, so Bourne was lower. So there's the incidence rates are what they are. Looks like they're highest mid-Cape. And most of us are in sort of that teens to 25, 28 in range for our incidence rate. So that's a number of cases per day if your population was 100,000. Positivity, we're at 8, Barnstable 10, Sandwich almost 10. A lot of towns around that 8 to 10, somewhere around that 5 to 6. So with the Outer Cape being lower, so that's what our positivity has sort of been similar pattern again. Now for a little bit. Vaccines readily available. Go online at vaxfinder.mass.gov. It's real easy to get a vaccine. There's booster doses, and over 50 for second booster doses, even under 50 if you've got certain comorbidities. So you can go right on there and find if you're eligible for a vaccine, either for the first one, your second one, your first booster, or your second booster. Very well laid out on the state's mass.gov website, so it's very well laid out. Vaccine you can find at the pharmacies primarily. Homebound people. So if you're here and you're listening to me and you're a summer resident and you haven't heard me do this before, if you have somebody in your neighborhood you see that's homebound, they're not making it out, someone even in your neighborhood, you could call the health department's 495-7485 or email us at health@falmouthma.gov, and we can send the VNA out to their house if they need one. Plenty of open spots, so there's plenty of availability for vaccine, and has been for a while. Testing, most people are using the home kits. They're just not going to be recorded by us. There's no mechanism for that. It doesn't go into the MAVEN, which is the network, the epidemiological network that all the towns use by the state. The state manages. So home kits are what they are. You could also have this test site at the hospital. You can use Convenient MD in the pharmacies. So testing is still available. We're still giving well over 1,000 PCR tests. I say about 800 to 900 per week. isn't, anywhere between 500 and 1,000 on a given week, I think I'm seeing for PCR tests. So they're still being used. But again, most people are using home kits. Just when you use home kits, if you're asymptomatic and you test negative, take a second test. Sometimes, they're not as accurate, definitely not as accurate as a PCR per se. Especially early on or late on in the illness, they may not be quite as good. But, home kits, they come in a package of 2. Test a couple consecutive times to get accuracy. And they're a good thing. No, they're definitely not a bad thing. As far as quarantining, again, depends on your vaccine status, whether you would quarantine or not. Vax and boosted, you would just not wear a mask and monitor your symptoms if you're in quarantine, meaning that you don't have it, but you've been exposed. People that have had it will be out for a minimum of 5 days. Symptoms would have to substantially resolve before you'd release. And then you'd mask for at least another additional 5 days. But those that have been quarantined, they don't need to have been vaccine boosted, but you would quarantine otherwise. And again, that can be also found at mass.gov. Just put in isolation and quarantine, mass.gov. It comes right up. It's real easy. If you're an employer, you'd want to have that listed so you know what to do if it happens. So testing and vaccines, we're in a good spot for that. Vaccinations, there were 377 since the 14th of June to the 18th of July. 300, it was 118 first, 100 seconds, and 159 boosters were given in Falmouth. These numbers and percentages changed a little bit because we went to 32,517. They changed the census numbers when they did the spreadsheets. So some of these percentages changed a little bit. It may not have captured somebody who recently moved because they may not fall into Falmouth. I don't know how that number grab happens or the percentage. But anyway, what matters is, are we continuing to vaccinate? And there's still a little bit of vaccination going on. 377 over a month. So, okay, as far as variants, you can see in that sort of medium green color how fast BA.5, the new variant you probably might have read of, is taking over from the more recent variants. So in the far left, you see the dark purple. That it was Omicron. That was the one in January. That's fizzled away. Was replaced by the BA.2, which was quickly replaced by the BA.2.12, which BA4, BA5 then just quickly took over, and BA5 is out competing BA4. And I think there's a new one, 275 or 27.5. There's another one that was coming out. It's just the way it's happening. It's just wave after wave. Some other color will show up in a week or two, and then that'll be whatever color they make it, and that'll start to do over. It's just the way it is. But BA5 is more contagious. They continue to become more contagious generally. But don't change in severity. So Vax boosters work. There's things like Paxlovid taken within 5 days. It's a pill. It's an antiviral. There's things like monoclonal antibodies and different treatments. So we're not seeing that people becoming as severe, especially those vaccine boosted, if with the treatments and with the vaccine. And these don't generally get to that lower respiratory and that deep sort of pneumonia that happened when you had Delta. But they still are putting people in the hospital, especially weakened immune systems and so forth. So anybody who's not vaccinated that falls into that weakened immune system category, if you haven't gotten it now, you probably won't. I'm just saying, advise you. But that being said, the variant of the predominant variant up here in the Northeast is the BA.5 right now. As far as a recap, our cases are stable, but on the high side. It's kind of the same everywhere. There's a fair amount of COVID out there. We're at medium based on our hospitalizations going over 10 per 100,000. We're at 10.3. Plenty of vaccine, plenty of testing capability, plenty of boosters. Consider your boosters. Your second booster if you're over 50. You can be boosted at under 50. I make sure I said that clear. It was your second booster I was talking about that's over 50. If you have certain comorbidities, you can do it at under 50, and you can again get that from mass.gov. Their website's fine. It's well laid out, pretty easy to go. When businesses call me about contact tracing, I just cut and paste that the information for quarantining and isolation to 5 days or 10 days and what to do if you're vaxxed. It's really pretty well laid out, and so it's pretty explanatory. Same thing if you want to look at whether you're eligible for a booster or not. Mass.gov is your place. Like I said before, BA.5 is the dominant strain. There are no mandates and advisories other than there is still a select board's advisory for masks indoors in town operated locations like here at Town Hall. But there are no mandates. There are no talks of mandates. There are no going back to mitigation at this point in time. So that's where we are. And so I will be doing these updates every 2 weeks. And if things change, if things go sideways, hopefully not, then we can always do these weekly. Okay, thank you.